Hi Patricia.
Hello.
So I will be your nurse for tonight, and my name is Nurse April. How are you doing?
Not so great. I just had an accident and I hit my head.
And just your head, or you hit any other part of your body?
My left side of the abdomen and also my right
Your
arm.
arm.
Yes.
Okay. And what happened? So how come did you have an accident? Did you fall
Uh, in the car.
in the car?
Car accident,
And
yes.
were you alone or with somebody?
With my dad.
With your dad?
He
And
was driving.
how is your dad doing?
He's fine.
He's
He's
fine.
fine. He just
So,
hit his shoulder.
and he's here with you?
Yes, in the other room.
Okay. I'm so sorry about this. Can you please confirm your date of birth?
Sure, 10th March 2004.
Okay. Do you remember when was your last time in the hospital?
I don't know, probably 2 years ago.
2 years ago? Because I saw in your chart you had another accident. Okay. Do you experiencing any fever? Do you
No, I
feel
don't think
hot
so.
or do you have any chills?
No, I just feel very dizzy.
You feel dizzy. Okay. So definitely I will check your head and I will do a cranial nerve exam to make sure everything is fine. I will also check your abdomen, right? Or more on your hip.
More on my hip, on the left side, right here.
Okay, and you said the right side of your
My arm.
arm. Okay, so let me check. I don't see any redness right now. I don't see any inflammation so far, but I will compare it with the other arm to make
Okay.
sure. Are you taking any medications right now?
No,
Do you have any allergies?
not that I know of, no.
No. Um, were you under the influence of any drugs or alcohol?
No,
No. Do you drink?
no,
Do you smoke?
no,
Okay. Do you have any other problems
no,
or these symptoms that you want to tell me?
no.
No. So I will ask you now some questions regarding the like a family history, okay?
Okay.
Regarding you or your family. Do you have any muscular or skeletal problems?
Scoliosis.
Scoliosis. Do you have any
Yes.
back pain right now?
No,
So you didn't hit your back?
no,
What about any problems with your digestion,
no,
circulation, nervous system?
no,
What about
everything's
any
fine.
migraines, tension, any stress related?
Only when I'm very tired. Migraines?
Migraines, depression?
No,
How is your sleep? It's good, it's poor, it's like an average?
it's good.
Good. Do you eat regular meals?
No, I just eat once a day because my stomach is full if I eat once a day.
And are you hungry right now? Do you want
No,
me to give you a sandwich or something from the cafeteria?
no, thank you.
No. Do you have any food allergies that I should know?
No,
Okay. How is your skin type? Let's see, it's dry, it's oily, it's a combination.
it's regular, I think.
I think it's a combination, right?
Yes,
But looks very good so far. How is your stress level?
average.
Average.
Yes,
Any history of high blood pressure, diabetes in the family?
no,
No. Good. So let me take a look at your appearance, at your color. Looks great, normal for for your age. Good. So I'm gonna do an assessment, a head to toe assessment, and we'll go from there to see if you need any treatment. Okay?
Okay.
Perfect. Do you have any questions right now for me?
No.
No? Okay. So Patricia, I will put my gloves on and I want to take your temperature to see, to make sure you don't have a fever, especially now after your accident. Sometimes fever can occur, especially if you hit your head. So I think it's very important, at least for the first hours, to make sure your vital signs are in good condition.
Sure.
So this is 37.3 in Celsius. It's a mild fever. It's low, but still it's a little bit of fever.
Okay.
So I will check it out one more time at the end, okay?
Yeah.
And this is going on the index finger. It's going to check your oxygenation level and the heart rate. Okay, so let's see. The oxygenation level is 94 percentile of room air. The heart rate is 90. So it's good. The oxygenation level is a little bit on the low side, but anyway, that's why you are here, to see what we can do about it. Okay, so if you're in this position, I will check your arms. You said you hit your arm this side, right?
Yes, in the door.
In the door. Do you have any pain if you do this?
A bit.
A little bit. And do you hit your elbow or on the upper side or?
This whole side. This right here.
Okay. So I'm also going to check your arm temperature, and I'm going to compare it with this one to see if they have the same temperature. They do have, so they are in the same condition. I'm checking your skin a little bit, your nails, and can I see your palms as well? Okay, so skin color looks great, and I told you I don't see any redness. It's a little bit stiff. Maybe you will have some bruises because you hit yourself on the door, but I think it will go away.
Okay.
I can prescribe, if you want, like an anti-inflammatory cream, so you can use it here.
Thank you.
So do you think, are you able to sit a little bit on the table so I can check your head better, a little bit your face?
Sure. Yes.
So just if you feel fine for a few minutes.
Sure.
Okay. I would like to listen to your heart and lungs. So just breathe normally, please. And please take a deep breath in. Exhale. One more time. Exhale. Take a deep breath in. Exhale. One more time, please. Okay, you can breathe normally now. Yeah, I'm gonna listen to your pulse as well. So you have a normal sound of the heart, the normal rhythm, so that's wonderful. And I also, I didn't hear any infiltration of the lungs, any wheezing or something, so that's great.
Thank you.
Okay, tell me, do you have any headaches right now? Any pain?
I feel dizzy.
You feel dizzy? Okay, so let me check you out to make sure you don't have any cuts or any blood or something. Okay, can you turn your head a little bit this way? Just a little bit more. I'm checking here in the back. Okay, come back to like this and just lower your head. I want to check in the middle your hairline as well. Okay, everything looks great, so I will check now this side. Okay, you can stay like this. Okay. I will put my fingers inside to make sure I don't feel any bumps or any lumps. Okay, so far so good. I'm not feeling anything, so you are a lucky girl today. So Patricia, I'm going to tap on your face. I want to make sure I don't see any abnormalities after the accident, okay? So just relax and close your eyes. If you have any pain, let me know. That's perfect. So I'm going to take a closer look at your skin, at your face. Can you open your mouth, please? and stick your tongue and say ah.
Ah.
Your throat is a little bit red, but otherwise teeth look good, gums look great. You can relax now. Can you stick your tongue and move it to the side, left to right? Okay, good. Up and down. Okay, perfect. Can you puff your cheeks? Unpuff them. Okay, great. That's wonderful. So I'm going to palpate your face a little bit and your neck and here your collarbone.
Okay.
You can relax and close your eyes. I don't feel any enlarged lymph nodes. That's great. Maybe just a little bit here. Do you feel this one here?
Yes.
Maybe that's why you have the red throat. Do you feel like, or do you have any flu-like symptoms?
No.
No? So this one actually it's a little bit enlarged on the right side. It's not so bad, but it can happen sometimes. I don't feel any nodules. Do you have somebody in your family that has any thyroid problems?
Yes, my grandma.
Your grandma? So everything is looking good so far. Can you please swallow actually? Okay, great. I'm also going to check here on your collarbone. Great. Do you have any neck problem?
No.
No. That's good. Okay, that's great, Patricia. I'm going to check your ears right now. So just turn your head a little bit this way. Any problems with your ears?
No.
Tympan membrane is pro-gray. I don't see any redness or infection. Yeah, so no inflammation. Everything looks great. I can visualize the tympan membrane. Okay, Patricia, so I wanna do also a vision test, especially now. So can you please cover one of the eye?
Sure.
And I just wanna you to read a few sentences to see if you can do it.
Okay. Bart will not go. Bart will not go to school today.
Good. And the other sentence?
Amy had no marks on her paper.
Good. This one?
The kitten was so cute.
Good. So your reading is intact, I could say. So just cover the other eye now and read.
They took a picture at us.
Okay.
The man sang for us.
Good. And this one?
He's in the speeding car.
Perfect. So your reading is intact, I can say. Can you just look at me and follow the light, please? Good. And now just look at me, but try to look like behind me. Just want to check your pupils to make sure they are round and reactive to light. Okay, that's great. Let me also check your hearing. So tell me if you hear anything.
Yes.
Do you hear like what?
Like buzzing.
Good. Do you hear it now?
Yes.
Tell me when it stops.
No.
Good. Do you hear something now?
Yes.
Tell me when it stops.
No.
Perfect. So cover one nostril, please, and try to breathe through the other one. Just want to make sure it's not, you don't have any blockage. Okay.
It's fine.
It's fine. Cover the other
Yes.
one.
Fine.
It's fine, or it's a little bit obstructed?
It's fine, I guess.
It's fine. I do see you have a nose piercing. Let me check your nose. Is this okay?
Yeah.
Okay, yeah, looks great. So cover one of the nostril, please, and try to identify the smell.
Lavender.
Good. And cover the other one, please.
Apple.
Sure. And I'm also gonna put one drop inside your tongue. I wanna see if your taste is intact. So just one drop.
Vanilla.
Yes, that's good. So I want to see if you have any changes from last time regarding the stimulus, how you perceive the stimulus, if something changed from last time, because I know you told me you hit your head, but apparently I did check the cranial nerves and everything is great. So this is gonna be tall and this is gonna be sharp. So I'm gonna touch you on your face and on your chest a little bit, okay?
Okay.
So tell me, how do you feel this
Sharp.
and this?
Dull.
This?
Sharp. 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 Dull. Sharp. 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 Dull. 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 Sharp. 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 Dull. Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp. Sharp. Dull.
Okay. So just a little bit of confusion on some parts about sharp or dull, but I guess it's fine right now after you text and you said you are a little bit dizzy, right?
Yes.
Do you wanna lay down now?
Yes, please, because I don't feel so good.
Okay, so you can lay down and we'll continue with the exam.
Okay.
Okay, Patricia, so let's see. I will listen first to your belly, okay?
Okay.
So I did hear a lot of activity on your stomach, but it's like just normal sounds. So I'm going to visualize first, and then I'm going to palpate.
Okay.
So far I can see you have a red bump on
Yes, a
your...
mosquito bite.
It's a mosquito bite?
Yeah.
So you have it before the
Yes.
accident, okay. So it's a little bit big. Are you using anything?
Yes, a cream for allergies because I think I'm allergic to
You are
mosquitoes.
allergic? Okay. So you should just continue to use it because it's a little bit, it's big and it's elevated. It's red.
Yeah.
It's itchy as well?
Yes.
Okay. Okay, so let's see this side. How do you feel if I'm pressing here?
I feel little bit sore.
Sore? It's a little bit tender as well, but it's not like so bad. If I'm checking both hips, you have, it's a little bit more tender on this side than the other side, but it's not so aggravated so far. You can take some ibuprofen for the pain for a few days, and if it's not going away we can do an x-ray or an ultrasound. I'm also checking the thoracic cage, but looks and feels intact. Yeah. Okay, so I'm going to check your skin first to make sure I don't feel any other raised bumps beside the one that you had. And you said it's an allergy, right?
Yes.
Sorry, I see you're a little bit ticklish.
Yes.
It won't take long. Just a little bit here. Okay, everything is all right with your belly. I'm going to percuss now. Let me know if you feel any pain or tenderness any other side beside
Okay.
here. Okay, that's great. How do you feel?
Good.
Do you feel a little bit better?
Yes.
Okay, so if you feel a little bit better, let's take your temperature one more time to see if anything changed. So it's a little bit better now. It's 37.0. So before I think it was 37.3, right?
Yes.
So it looks like it's going down. And
Great.
that's great. Good. So tell me, Patricia, how do you feel this on your belly? Do you feel it warm?
Cold.
Cold? How do you feel it now?
Cold.
Good. What about now?
Cold.
Cold? All the way?
Yes.
Good. Tell me if you feel the vibration.
Yes.
Tell me when it stops.
No.
Do you feel the vibration?
Yes.
Tell me when it stops.
No.
Perfect. So this side, it is a little bit tender. I think it's normal. And take a few days ibuprofen, and if it's not going away, we'll go with an x-ray or an ultrasound.
Sure.
So I will check your feet and your legs to make sure I don't see any cuts or any edema or inflammation.
Okay.
And if everything is all right, then I will tell the doctor your results, and I think we can discharge you.
Sure. Thank you.
Okay. Okay, so I'm checking both legs. Good, so I don't see anything alarming. And they have the same temperature so far. I'm also checking for edema. Okay, perfect. Can I take your socks to make sure everything is alright with your toes?
Sure.
Just lift your leg a little bit. Okay, everything looks great actually. Your toes, your nails. I think you were very lucky. Let me see the capillary refill. Great, it's within 2 seconds. Great, let's see the pedal pulses. 2, 3 plus. Good. And I'm going to check the Babinski reflex. Okay, let's see this one. Good. So I can, you can put your socks back.
Okay.
So I have good news, Patricia. I'm done with the exam. Everything is great. You're in good condition. I didn't find anything abnormal under your entire body. And I think it's normal if you have some pain here and there because you hit yourself, and I think also that's the shock.
Yeah.
And like I said before, cranial nerves are intact, and if you have more pain or discomfort, I think we should do some CT scan or an MRI also of your head to make sure your hip is fine, your arm, okay?
Okay.
But I think so far you're doing great, and I'm going to talk with the doctor so he can come to see you, and I will show him the results. I think we can discharge you because you look good.
Thank you very much.
Do you have any questions?
No. Thank you
No?
so much for seeing me.
And
for
I'm going to
helping.
bring you if you want some ibuprofen for the pain.
Yes,
And
please.
if you want a sandwich, I can bring it to you in some water.
Just some water, please.
Okay. Take care and be safe.
Thank you so much.